My name is Priska Chanda. I'm a nurse practitioner student at Walden University. I am going to do a head-to-toe assessment on Malik. Malik is my MEC pretend patient. He is here for a physical. You're here for a physical, Malik?
Yes, I am.
I'm going to do a head-to-toe physical assessment on Malik. First of all, I'm going to look at Malik and look at his tone, symmetricity of his face, symmetricity of his head, and just the general appearance, and he looks pretty healthy. I am going to palpate Malik's head to make sure to find out if there are any lesions or bumps, and I don't see any. I see that his hair is evenly distributed. It's clean. It's nice and shiny. His face has a good tone to it. It has good coloring and it's even. His eyes are well located on his face. His nose, his mouth, everything is well proportioned. So I am going to test Malik's optic nerve. That's number 2. The cranial nerve, number 2. To do that, I will use the Snellen chart. I will hold the Snellen chart about 20 feet. Then I will have Malik close one eye and read any line that's comfortable for him.
EDFCCP.
Cover the other eye and read one line going backwards.
FZCFDE.
Thank you. So Malik's cranial nerve number 2 is intact. With that, I am going to check Malik's cranial nerve number 7. And get a little piece of cotton wool. I'll have Malik close his eyes, and then I'll have him identify what part of his face I'll be touching.
Forehead, nose, chin.
So that's cranial nerve number 7. So I will go forth and go and assess Malik's cranial nerve number 3, 4, and 6. And all those are pertaining to his eyesight. Malik, when I move my fingers, you're going to let me know if you see my vision, okay? If you see my fingers. Can
Yep.
you see my fingers?
Mm-hmm.
Can you see them?
Yeah. Yep. Yeah.
Okay. So continue looking at my nose, and without moving your eyes, follow my fingers. Just with just your eyes, without moving your head. Okay. And then, so with that, Malik's cranial nerve number 2, 3, 4, and 6, as well as 7 are pretty intact. I will now check Malik's ears, and I see that they're well positioned on his head. I will look inside the ear to see if there's any discharge, lesions, or anything that's not supposed to be there. And with that, I'm going to test with the light. Okay, that is good, well coloring and pink. And so is this one. So his ears well positioned, and it seems to be well placed. I will go ahead and test Malik's trigeminal nerve. That's cranial nerve number 5. With that, that's what controls chewing and the mouth. So Malik, I am going to palpate the trigeminal nerves right in here in the jaw. Can you please open your mouth? Close it. Can you move your lower jaw side to side? Can you blow and hold like? Okay. When Malik does that, there's no drooping. Everything is even. None of the face is the face is even. All right. Can you show me your teeth? Teeth are symmetrical, white, and the gums are nice and pink and healthy. Can you move your tongue out? Okay, back in. Can you push your tongue here and to this side? Okay. That's intact. I'm now going to find out if Malik's shoulders are symmetrical as well. So Malik, with that, I'm going to have you shrug up your shoulders. Can you do that? Okay. Can you do that? Put them down again. Can you face that way? Does it hurt? Can you face the other way? Can you bend your neck towards this way and the other way? Malik seems to be in good physical shape. So Malik's just assessed his cranial nerve number 11. So now I'm going to go look at his chest. I'll listen to his chest and see if there's any abnormal sounds in his chest. The lung sounds in the front of the chest seem to be okay. I'm going to check the lung sounds on the anterior aspect of his chest. Sorry, that was the lung sounds on the posterior side of his chest. The anterior side of the chest were good. I'm now going to listen to the lateral sides of his chest. Breathe in. There was no rubbing in his chest. His cardiac had a good beat to it. It had about an 80 beats per minute, which is pretty healthy for a young man. I will look at Malik's. I will look at Malik's fingers. Let me see your fingers. I'm looking for CSM to see how his heart is perfusing, and he has no more CSM. He has less than 3 seconds of his CSM. There's no swelling. The hands the same size, and he's well coordinated. One more thing that I forgot to point out was the hearing. I apologize. So with this, I'm going to use a tuning fork. Malik, when you hear the sound of this vibrating, let me know, okay? Can you hear it?
Yeah. Yeah.
Can you hear it?
Yeah.
I forgot that, but I remember. Thank God. All right. So it's unfortunate that we don't have a good table, so Malik's feet are not dangling. If I had, I was going to use a plexor hammer to check his muscles and to nerves on his knees to see if they were positive flexing or not. But as for now, I'm just going to check his abdomen. Malik, I just need you to lay down here. For his abdomen, I'm just going to visualize it, and then I am going to auscultate before I palpate. He has positive bowel sounds, and they seem he has good positive bowel sounds. I am now going to palpate, and Malik will let me know if there's anything that hurts. Malik, let me know if anything hurts. No? Nothing hurts, and so that's a good sign. So everything bounces back as they should. Thank you, Malik. You can stand up. You can sit up. And then, Malik, can you turn around and face that way? I want Malik to breathe in and out, and then with that, I'm going to check the symmetry of his lung sounds as well as his back muscles as he stretch, Okay, can you breathe in, out, in and out? Okay. So the symmetry, my hands had equal movements on both sides, and that shows that his lungs have good perfusion and good expansion during breathing. I am going to go ahead and I'm going to percuss. With that, I'm listening for any variations in sounds as I was percussing on his lung sounds on both sides, and there doesn't seem to be any problems. I look at his spine, it's even, it's straight, and so his head is normal with his neck and everything, so he's pretty healthy. His carotid nerves here seem to be well and bounding. I can listen to them and find out if his cardiac is beating well, his heart rhythm is well regulated. I could hear the blood swishing normally in both carotid arteries. Malik, turn around. That concludes my head to toe assessment with Malik. Thank you.